Thank you for coming. I'm Patrick Moody. I'm Director of Marketing and Public Relations for Henry Mayo Newhall Hospital. We know this was hastily called, so I thank you for coming. We have seen an upsurge in overdose cases in our emergency department, especially in the last 24 hours. I have with me today Dr. Bud Lawrence, one of our emergency room physicians, and Carrie Quashen, who is Executive Director of Behavioral Health for Henry Mayo Newhall Hospital, and also Director of Action Family Counseling. And with that, I'm just going to turn it over to Dr. Lawrence.
Thank you, Patrick. So I'm here today to talk to you a little bit about sort of the events over the past 12 to 24 hours. Really just wanted to draw some community attention to something that has occurred. We sort of have, much like the rest of the country, really, there's a bit of a hum of cases of heroin abuse and heroin overdose that occur in our emergency department, much like every other suburban city in the United States. We see these cases come and go, and it's sort of at a relatively stable level. However, last night, we had a total of about 8 cases of patients who came in with overdose of opiates, of heroin. And from a public health standpoint, the emergency department, the hospital, it's just concerning to us that there may be something out there that the public should be aware of. I don't think that it's more of an issue in Santa Clarita than anywhere else, but occasionally we see little spikes where there may be a difference in the quality or the content of the drugs that are being ingested, and this seems to take its toll on the population of users in that environment. And we did have a fatality last night. It's very disconcerting for us. I live in this neighborhood. This is my neighborhood. I have children, and I love this neighborhood. It's a great place. I find this to be a wonderful neighborhood to raise a family, and I think that this is something that we should all just be aware of and spread this word. I think that it should be something that we should educate everyone to not be using drugs, certainly, and certainly not be using heroin. But those of us, if we happen to know someone who is in a circle of addiction, please be aware that there is something dangerous out there right now, and please take appropriate precautions, ask appropriate questions, and please find a safe environment. If at all possible, stop using. I'll turn it over to Carrie to answer, perhaps talk a little bit about the cycle of addiction and any other further information he may have, and I can come back and answer questions at all about the emergency department and or anything else that may come up. So, Carrie.
Thanks, Bud.
First, we want to definitely thank everybody for being here, and I just want to say a few things. Number one, all drug abuse starts innocently. And nobody ever says, I'm going to wake up and become a heroin addict. So it always starts innocently. What's really scares me the most is besides being the executive director here at Henry Mayo for behavioral health, I also own a drug and alcohol treatment centers. And if you look at drug and alcohol treatment centers these days, our adolescent population is dwindling, meaning that parents aren't wanting to put kids in treatment because it's only pot. Then if you look at our adult residential treatment centers, we're exploding from 18 to 25. And I'm not saying that everybody that smokes marijuana is going to become a heroin addict, but I will say that almost every heroin addict that I've ever met started with marijuana. So we really do. We need to educate our children when they're young that all drugs are bad, that all drug abuse starts innocently. And because now we're in the midst of an epidemic. You watch CNN, watch Fox News, watch anything, and they're saying we're in an epidemic, and I really want to get this straight, that we don't have more drugs here in Santa Clarita than anywhere else. It's an epidemic across the country. But when we see 8 people come to the ED and we have fatalities, we have to pay attention to that. And we have to get the message out, hey, be careful out there. But it's not just heroin, it's all drugs that we want to pay attention to. You know, it's really scary. Think about it. In 1 hour, 9 people are going to die from an accidental overdose in this country, in 1 hour. That's not including car crashes. arrests, homicides, domestic violence. I can go on for days. That's just an accidental overdose. Imagine if 9 people died every hour from gun violence. People would be screaming. We need to start screaming across the country about this epidemic. And if people people get up here and start speaking about it, maybe we can stop it. I don't think we'll ever take drugs away, but we could stop the need. And that's what we have to do. So you want to open it up for questions, or what do you want to do, Bud?
Sure, that sounds great.
Yeah.
Happy to answer any questions you guys might have.
Do we know why all of a sudden we're seeing this influx? I mean, is there something different than before? Because people have been using these types of drugs for a while. And why all of a sudden we're seeing a change?
We could speculate, right? We could speculate. We don't have hard data on that. We don't have a the hospital is we have a drugs of abuse panel that we can send, but we don't have a forensic laboratory. But we could certainly speculate, as we've discussed, that certainly the drug could be more potent. This batch of drug could be more potent. They can cut it with other drugs. We don't know this to be true, but that's something that historically has been seen in other metropolitan areas.
But what we do know is that 8 people did overdose in one day, and that's pretty scary.
Is there any similarity between the patients at all, in the cases?
They all used heroin. That's the only similarity, but they were all younger patients, not pediatric, but young adult.
And earlier you had mentioned there was a fatality last night. Is that in addition to the fatality Sunday night?
I wasn't aware of the fatality Sunday night, but there was one last night, so that would be an addition, I would assume.
The one last night, just so we're clear that about the one from Sunday night as opposed to last night, it was definitely last night that you...
There was a fatality last night, correct, yes.
And that was male, female? Could you say
I
anything about it?
can't say.
Was there anything that aside from the heroin, obviously, that you could look at and say, okay, this is a narrow your focus, as it were, to what the core of the problem was, aside from just heroin? Was it injectable? Was it any particular type of awareness?
Potentially, I would leave that up to the police department, though. I don't want to speak on that specifically, but they may have other information, perhaps. We do see, though, as with most communities with heroin use across the board, the patients are generally ingesting it 3 different ways. The most common ways are either smoking it or injecting it. Those, I would say, would be the most common ways by far.
And not saying I mean, that's what I do. I've been dealing with people using drugs for over 30 years, and what I'm hearing is, well, I'm only smoking it. Just as dangerous.
And can you describe, maybe talk a little bit about the state that they came in? Did it vary? I mean, were they all unresponsive, comatose? Can you talk a little bit about their...
So I can't give specifics about each of the patients themselves. There are patient privacy laws that protect them,
Sure.
but I can say globally, majority of patients that overdose on heroin, when they do come into the emergency department, they're generally in a state of respiratory distress. So the drug itself, like all opiates, is going to depress the respiratory drive. So they're going to have slow respirations or not be breathing at all. And that's going to cause a lack of oxygen to the tissues, in particular in the brain and the heart and kidneys and liver. So it can become a very critical issue, particularly because a lot of these patients, when they come in, they may not come by paramedic ambulance, which is another community piece there, is that the paramedics, 911, they have Narcan, which is now also available through the pharmacist. You can actually get it at the pharmacy, which is the life-saving drug for this overdose. So 911 can actually be life-saving. The paramedics carry that medication on their rig. But a lot of these patients get brought in by private automobile, and because of that, they have really long transport times. And when you're talking about time where these patients aren't breathing well or aren't breathing at all, it can be catastrophic in terms of brain injury, which is really our main outcome we want to look at, is are these people going to get up, stand up, and walk out of the hospital at the end of all this?
In terms of staffing, were you able to adequately, get to everybody?
Absolutely, yeah.
8 seems to be a lot of time.
It is. It's a lot, but our emergency department here, we are very well staffed. As we say it, often we staff for success. We staff for success on a nursing level. We overstaff from a physician standpoint. We have double coverage. We have 2 physicians working all night in this emergency department for this city. We always have 2 doctors here. We've got a large amount of nursing staff. We have a trauma surgeon here 24 hours a day. we are very well prepared for this kind of an issue. And like I said, with the opiate overdose, the treatment is Narcan, which is easily, we can give it so quickly, it turns the patients around, unless, of course, it's too late, or that patient doesn't get found in time,
Or it wasn't an opiate.
or it wasn't an opiate, which there are many drugs, obviously.
Narcan actually is a miracle drug when it comes to opiates, but it doesn't work for other drugs.
Right.
Carrie, I mean, one of the outlets is broadcasting this live. I'm being asked to have you speak up when you speak.
Okay, gotcha.
Sorry, I'm loud.
There's been a rumor that this heroin's been cut with fentanyl. Could you speak to that at all?
So again, we don't have a forensic lab. I can't speak to that in any kind of factual sense. I can give you from a historical perspective that is something that other parts of the country have seen in situations like this, where you have a mass, multiple overdoses in a short time period. They have seen heroin cut with fentanyl. Fentanyl is a synthetic opiate. It's very strong, and it produces a significant effect with respiratory depression. And so if you cut your heroin with fentanyl, that would make it much stronger than the user would otherwise expect to be getting. So if they use the same amount they may otherwise be using, they would have a much larger effect than they would otherwise expect, which could lead to an overdose.
I know I'm getting into the particulars, but I just want to get as close as I can to understanding the 8. Did they all know each other? Did they all come from the same place?
I have no idea. To be clear, I'm here speaking with you today. I'm the Director of Risk Management for the Emergency Department. I wear a lot of hats in the hospital. I'm here to try to serve the public and be an advocate. I was not working last night. I was here. I came in the morning and got this information from our staff directly. I started at 6 a.m., so I was debriefed by all the night staff, nurses and physicians on everything that occurred. I carry administrative duties in the hospital, in the emergency department. So,
I think one of the things that people would like to know is how the 8 are doing.
I can't discuss that. I'm sorry, I can't speak about those patients specifically. Apologize. Are there any other specific questions we can answer?
I would like to say this, though, is when somebody is buying heroin, no one really ever knows what it's cut with. In fact, sometimes even the dealers don't know. They're getting it from their suppliers. So when anybody, and this the message that I want to get out, when somebody is sticking a needle in their arm, they're really playing Russian roulette. You just don't know. And I deal with heroin addicts every day, and they tell me the same thing. I know I'm dealing with Russian roulette. I've overdosed the other day. My heart skipped beats, and I mean, it's really a scary deal across the country right now.
And Carrie brought up the point that this is a national issue. It really is. I mean, as a physician, I got a letter from the Surgeon General about 4 or 6 months ago about opiate overuse and how it is really an epidemic. And it does, the heroin issue that we are seeing nationally, a lot of this starts with pills, starts with prescribed medications. It's an often quoted data about how there are more people that die from prescription medication overdose than automobile accidents, and it's real. In Henry Mayo, and at least in our emergency department, we are taking strides to try to treat our patients safely. We have a narcotic safety program so that we can enroll patients in that program if we feel that they are high risk for narcotic overuse. We really try to do our part to help affect the community positively in that way, because we do have an understanding that we as physicians and as health practitioners, we carry a lot of this burden, and we need to make sure that we're being responsible as well.
And there's also two different, I mean, you said it when you said they start with pills, a lot of people, there's two different kinds of drug addicts that we're seeing now. You got your normal drug addict that grows up, says, I'll never smoke cigarettes, and they start smoking cigarettes. Well, it's only a cigarette, I won't smoke weed, and they start smoking weed. Well, I'll never use hard drugs, and they just go on down the line breaking contracts, and we know who they are. They have the addictive personalities, and they're high risk. We've been treating a lot more accidental addicts, too, in the last few years when it comes to prescription pills, with no track record, no history of substance abuse, that for whatever reason started with pills and got physically and now emotionally addicted to it. And when they run out of pills and they start doctor shopping and the doctors say, enough, we have a problem here, then they go to the street.
In the narcotic safety program, the program members, did you ever look at the impact of opiates that are sold by pharmaceutical companies that are so strong that, for me, it would be a concern. I'm wondering if you on the safety board have a concern about opiates that are marketed by pharmaceutical companies.
There are concerns. That's a bigger discussion, though. I mean, that's off topic, but I think that there is a need for some of these medications. You have cancer patients. You have patients who are certainly requiring some of these medications, but that's not something that I think I'm prepared to talk on today. I think that from a general perspective, those are not medications we prescribe from the emergency department and generally not even from the hospital upon discharge. But the ones that we do prescribe from the emergency department, we try to be accurate and judicious about how we choose to prescribe those medications and even deliver those medications parenterally or through the IV or intramuscularly, because we want to make sure we're treating our patients first and foremost safely.
And remember, you can't see pain.
I know.
You can't see it.
It's very challenging.
So Dr. Lawrence actually has to get back to the ED, so if there aren't any more questions, is that okay? Be okay? Okay. Well, thank you very much.
Thank you.
For your time.
Good.